Myth or fact, perimenopause ends at age 50. I'm Dr. Sakina Davis, and I'm with Woodlands Wellness and Cosmetic Center and an expert in hormone therapy. Perimenopause is defined as the years that our hormones start to imbalance. It's very important that we realize that this can be different for different women. So, for some women, that can start at age 30, it can start at age 35. And most women will go through menopause anywhere from the ages of 45 to 55, with the average age being around 50 to 51. Now, let's define menopause. Menopause means the actual cessation of a menstrual cycle for 12 full months. But all of the symptoms that occur prior to that is what we then define as perimenopause. Perimenopause can be a very difficult time. You can start to experience some night sweats, some trouble sleeping, some brain fog, some joint pains, weight fluctuations, a drop in libido, lots of different things that are just not who you normally were. And so, what is going on that is causing that? Well, typically, what we find is that the hormone imbalance begins with the hormone progesterone. So, progesterone is the hormone that we should start to see increase in the luteal phase of our cycle, which is the second 2 weeks, day one being the first day of your actual period. So, around day 14, we should start to see this surge of progesterone. And what we find is that for various reasons, whether you've had children or stress or tubal ligation, or whatever reason, we find that the progesterone levels are just not balancing as they should with estrogen. When that progesterone level falls, you can start to experience those PMS symptoms, get really crabby, really irritable, start to have headaches, trouble sleeping, all of the things that I mentioned before. And so now we're able to compound and use bioidentical progesterone that we have you take starting around day 14 until you start your menstrual cycle again, which will pretty much eradicate those symptoms once we get the dose correct for you. And we can then adjust that dose of progesterone over the years until we see that you're going to need some estrogen. And at that time, we will obviously begin estrogen. And we sometimes will use that, both of them at the same time until you transition into menopause and then definitely after menopause.